All right, so we'll move on to the next sport. Now we're going to talk about common injuries in figure skating. So what are some of the unique demands of figure skating? Well, the sport itself is unique. It's an artistic sport, and it involves a lot of artistic-like movements in multiple directions. They purposefully jump and spin, and they do it all on ice, right? And there's no protective equipment. They wear minimal amount of anything when they're out there figure skating. The other thing about figure skating is because it's an artistic and aesthetic sport, there's a big emphasis on body image. And there's not just a figure skating coach. There are coaches for strength and conditioning, jumps, spins, choreography, speed, and power. So there's a lot of coaches involved in a figure skater's life. Well, why is this important to know? Well, that and the fact that this is a body image sport, that can put these figure skaters at risk for RED-S, or relative energy deficiency in sport, which is also known as the female athlete triad. Okay, so just be aware of that. What are some of the injuries that we see in figure skating? Well, most commonly, with all the skating and jumping that they do over and over and over again, you're going to see a lot of foot and ankle issues. And then second and third, you'll see some knee and back issues as a result. Other concerns, less common, but more of the acute issues: no protective equipment, sharp blades on their skates. You always have to keep an eye out for lacerations. And like we said, always keep an eye out for relative energy deficiency in sport. So here's some advice from an expert. This is our great sports dietitian, Taylor Morrison. Not only is she a sports dietitian, but she's a former figure skater herself. So here's a couple of pointers from her. So if you're a primary care provider, she says, always keep an eye out on a figure skater's weight, all right? And then keep an eye on their growth as well to make sure it hasn't plateaued. And then always ask about their menstrual cycle, if there's been changes to it, or if they've not had menarche by age 15. All of these would be concerns that patient is developing relative energy deficiency in sport, or the female athlete triad. Well, what if you're just a general medical professional, a parent, coach, or athletic trainer? She says, keep an eye on mood and energy levels. Keep an eye on food, including food intake and food preferences. They may be subtle of they're just becoming a more picky eater, right? Or, wow, they're just only eating vegetables now, not anything else. And then keeping an eye on changes in their training schedules, both on ice and then their dry land off ice as well, all right? So what can you do in addition to what was the advice given by our expert, Taylor? If you're not as familiar with the female athlete triad or relative energy deficiency in sport, educate yourself on it. We're learning more and more about it. There's a great talk by Dr. Chung that is available on demand that you can access, that she talks a lot about these aspects. And then other things that these figure skaters can do is focus on core strengthening, right? We see a lot of back issues, and then foot and ankle mobility and strengthening. Similar to hockey players, right? Their ankle and foot are locked up in those skates for a long period of time. And then if you're ever at any type of figure skating practice or event, be ready for lacerations, and these lacerations can occur on a limb, and so you may want to have a tourniquet available too in case it's more of a more serious laceration.